everyone. Welcome back to one of our webinars. I want to thank Brightbud.com for sponsoring them. I would like to remind you that throughout the presentation, your microphones are going to be muted. At the end of the presentation, we're going to give some time for you to ask some questions. If you maybe have questions after that, or you're not watching this webinar live and you have a question, you can go into Brightbud.com and record a video question, and me, Dr. Martinez, or somebody else that knows about it will give you an answer. So let's begin. Remember, these webinars come from Dr. Martinez and my medical experience, but they do not replace the medical consultation. 1 second. Okay, so Dr. Martinez and I were going to be talking about progressive loss of vision. For those of you who are new, my name is Jaime Meza. I'm a medical doctor. Today, Dr. Luz Martinez is presenting with me. We are both medical doctors specialized in chronic conditions. Dr. Martinez now, she is a little bit more specialized in vision, so I'm very glad she's here because she can give us a lot of information about eyes and vision in general. So let's begin. First, I like to start always with some amazing facts. Of course, we have to remember that the eye is one of the organs that grows the least over our lifetimes. So basically, in a certain way, we are born with very, very big eyes compared to our heads. And that is the reason why we can say that all children are born with a certain degree of vision impairment. Either they are farsighted or nearsighted, but they, as we grow and the eye changes proportion, then our real vision develops. So it is acceptable to a certain point in life to have certain visual impairment. The corneas are very crucial for sight, for vision, but they do not have a blood supply. And I think that's amazing. It's one of the only organ that actually doesn't have a direct blood supply. So there's no blood in the cornea. It gets its nutrients from a different source. Also, the eye has millions of connections with the brain through nerves and thousands of blood vessels that basically make an eye transplant impossible for current technology, because sometimes we talk about eye transplant, but what we really mean is cornea transplant, because that is something we can do today. Maybe in the future it will be possible, or even some other type of transplant, but right now the entire eye is too complex to be transplanted. So here in the picture you can see basically this part that represents the cornea that can be transplanted, and that it's also easy because, as I mentioned before, it doesn't have any blood supply, direct blood supply. Numbers, it's very difficult to actually talk about numbers because there are so many different depending on the condition, but I think there's only one number that really matters in this presentation, and is that blindness is preventable in 80% of cases. So if you see blind people, obviously that they were not born blind, but they became blind, that condition had a very good chance of being preventable, at least in 80% of cases. So I guess if we know more about it, then this is something that we can really change. This is a number that we can really change, and we're trying to. Okay, when talking about progressive loss of vision, we have to address this first one because it's very, very common. Presbyopia is, I think, one of the most common causes for loss of vision. Basically, it's an eye condition related to age. in which the lens, which is a part of the eye, cannot change shape as easily as it did before. So basically, it results in an impairment for near vision. So um, basically, you can see in this picture that with the where I'm pointing here, that's the lens, and basically uh, the muscles that contract or relax the lens to make it change shape do not work as they used to, so the light is not focused in the same place. And I'm pretty sure when I mention the symptoms, some of you are going to be very familiar. Of course, that's number one. When you start putting whatever you're reading farther and farther, then that's symptom number one. Of course, that didn't happen since you were born. It started to happen between 35, 40. Actually, it's an age that basically it happens. It doesn't matter if you didn't have any other visual condition before, it can still happen. You're going to start seeing things a little blurry, especially when you're reading books or newspapers. You might have some mild headaches, of course, because you're trying too hard to read, and of course you don't realize that you're having that problem. It is very, very common, unfortunately. I would say that everyone will have it, no matter if you had a previous condition or not. Some people get it a little earlier, some people a little later, but we are all going to have it. It's basically pretty normal. The treatments we have, of course, you've seen them, the bifocals. Those are lenses that correct far or distance vision, but also have like a little part where you used to read close objects or for near reading. They're progressive, which have a little part of the lens that is used for distance vision, one that is intermediate, and one that is for near vision. And we could have contact lenses that have similar technology. Now we have, and we even have surgeries to correct presbyopia. It's a little complicated sometimes because what corrects the near vision will not correct the distance vision. So sometimes we play, and in some cases, when people use contact lenses, they will end up using one type of lens in one eye and another type of lens in the other eye, just to be able to see distance and close. Unfortunately, fortunately, this is something that will not lead you to blindness, but it will definitely affect your vision. So I want you to know that if you are in that age, 40s or older, and you're experiencing this type of symptoms, probably this is what's going on, and it's very benign. It's not going to make you blind. Basically, most people use bifocal or progressive lenses, and that's it. There are other alternatives with surgery. Still not so popular right now, but there are.
Okay, now we're going to talk about two of the most common diseases that can cause blindness in difference with presbyopia. So the first one is glaucoma. What's the meaning of glaucoma? Glaucoma is a group of diseases that damage the optic nerve and can result in vision loss and even blindness. It is important you to know that glaucoma is the second most common cause of irreversible blindness in the world. So it is irreversible because glaucoma, because of the meaning, is a progressive disease. It has nowadays no cure. Of course, we have some things that we can do to reverse the severity of the disease, but it is a progressive disease. So now we have an eye. I'm going to explain you why it's important to know about the optic nerve and why the glaucoma is so severe when it damages the optic nerve. So the optic nerve, as it is shown in the slide, is in the back part of our eyes. It's like a large cable that is formed by more than 1 million of fibers of nerve fibers. It connects the retina, that is also in the back part of all our eyes. The retina is a sensitive tissue that its functions is to receive the images, and the light beams, as you can see in the picture, convert them, the light impulses to nerve impulses. So then those nerve impulses travels through our optic nerve to our brain. Sorry. So it is so important because it's like the cable that connects the eye to the brain. So without optic nerve, you will not have so vision. So you could have a normal eye, but without an optic nerve, you will not see anything. So now I'm going to explain you how does the optic nerve get damaged. The first thing, and I know all of you have heard once, that if you have high intraocular pressure, you have glaucoma. That's not 100% certainty or true, but at least 85%, 85% true, because there are people that have glaucoma, but they don't have high intraocular pressure. And in the other hand, we have people with high intraocular pressure without glaucoma. But yes, intraocular pressure elevated is a risk factor, and it's the most important factor for having glaucoma. Almost 60% of people with high intraocular pressure will develop glaucoma in the future. So now, to understand why intraocular pressure can damage the optic nerve, I'm going to show you these images. And this shows us that we have two kinds of fluids in our eyes. The first fluid, and the most important, is called the aqueous humor. The aqueous humor is located in the front part of our eye, that is called the anterior chamber. So now we are showing you where it is formed. It is forming a structure that is called the ciliary body. In ciliary body is produced the aqueous humor, that is a fluid, and after that, as you can see in the arrow, it flows through the lens. After that, it flows through the iris, that is the color part of our eyes, and after that, it can exit from the eye through the angle. As you can see, it forms an angle through a meshwork that is called the trabecular meshwork, that is like a spongy tissue that just take off this fluid and let the eye with the fluid system normal. So if this angle and this meshwork is blocked or clogged for any reason, the fluid will back up and you will start having intraocular pressure elevated. And now we are going to show you in the next picture how the intraocular pressure can damage the optic nerve. So now let's think your eye like a balloon. If you start just blowing air in the balloon, it finally will plop out. Of course, our eye will not plop out because it is too strong. But if we start putting a lot of fluid because the angle is closed, the fluid will get located in the posterior part of the eye, as you can see in the picture, and it will search for an end stage or a weak part of the eye to leave out the eye. Unfortunately, the weakest part of our eye is where the optic disc, optic nerve is located. So as you can see in the picture, the pressure of the fluid will start compressing our optic nerve until getting to a damage of the optic nerve. So if you have a damaged optic nerve, you will not have a good vision.
So basically, we're saying that the eye is like a balloon filled with water. So this water is produced and then it's supposed to drain in the anterior part of the eye, which we call the angle, which I showed before. So basically, if something clogs that, let's say, that drainage, then this liquid will be produced and will not be able to exit through anywhere, and it will start filling and filling the eye more and more. It will try to exit through whatever part it can, and as Dr. Martinez said, the weakest point in this balloon is where this cable enters the balloon, the eye. So it will try to break this part because it's the weakest, and it will create pressure, and it will start creating this that I showed here, and Dr. Martinez was explaining. Of course, that will create a lot of pressure there.
Yes, that's it. So as I will tell you before, we have another risk factors, different like intraocular pressure. For example, having family history of glaucoma is one of the most important ones. So if you have some parents with family history, you will seek your ophthalmologist. Another one, and very important also, is the age. If you are more than 60, your risk will increase even years are passing. And the other one, and so important also, is the race. We have here two pictures, one of an Asiatic woman. As you can see, and as you know, Asiatic people have smaller eyes than we do. So if we have a smaller eyes, the angle will be closer, and they have are in risk factors of having glaucoma. Also, African American people, because of the melanin, as you know, the melanin is increased. The melanin can clock this angle that we were talking about before, and can produce the glaucoma. Uh, so now symptoms, unfortunately, at the first stage of the disease, we have no symptoms. You will not have your pains, your eyes will no pain, your vision will be normal. But and at the end of the disease, or maybe 10 years after you're having the glaucoma, you will start having some kind of symptoms. For example, as you can see in the picture, in the inferior part, left inferior part, you can see almost a normal view, but the peripheral, the corners are getting dark, and that's the first symptoms we can have. People with glaucoma start losing their peripheral vision first, and in extreme glaucoma, as you can see in the last picture, they will see just like if they were in a tunnel. So it is quite typical, and in the other images, of course, you can see the same picture. And how is detected if there are no symptoms? First, you have to go to the ophthalmologist. The diagnosis is completely clinical, so the ophthalmology with a delayed exam can see the optic nerve disc. So now in the right part of the slide, that's how we see the optic nerve in the lamp. So at in the left one is a normal one, and the right one, as you can see, is a white part, more bigger. We call it the excavation, and this is a patient, of course, with a glaucoma, almost with a loss of more than 90% of optic nerve. After that, if we find a person with some risk factors or with this finding in the optic disc, we can do some type of test, as you can see in the below part of the slide. The first one is the visual test, field test. The second one is the optical coherence tomography and the HRT. All three are always for really good help for the ophthalmologist, therefore for follow-up and for the diagnosis of this disease. Now in the treatments, it is important you to know, and I'm gonna tell you again, it has no cure. It is a progressive disease, so vision that has been lost before you diagnosis cannot be restored. We are trying with the treatment to delay the progression, so to preserve as lot as vision as we can as doctor for you, for having the final days with normal vision. So the first treatment that we can give to you are glaucoma eye drops. Is more easy than the other ones. We are looking with glaucoma eye drops to low down your intraocular pressure. We have another two kinds of treatments. In the left side, we see the laser, and the other one, we see a valve. Both two are searching to low intraocular pressure, and those are the treatments available nowadays for glaucoma. So now the second disease, and this is the second most common disease of cause of preventable blindness. So in this case, it's preventable because with a surgery we can give the cure, the total cure of this disease. And what is a cataract? A cataract is a clouding of the normal clear lens that Dr. Mesa mentioned before of your eyes that can cause really, really great problems in your vision. It is very common in older people, and it is says that by age of 80, more than a half of American people or either have a cataract or have had a cataract surgery. So, so the lens, it was that Dr. Mesa mentioned before, and as Dr. Mesa mentioned, the function of the lens is to focus the images in an exact point of the retina. So if you have a cloudy lens, you will not have just one beam of light, you will have a lot of beams, so your vision will be blurry and clouded, of course, and it will be not clear. So what causes the cataract? Normally the lens, as you can see, is made by water and proteins. It is completely clear and completely transparent. To be transparent, the water and proteins have to be in certain parts of this structure. But when you start aging, or you have diabetes, or you smoke, or you have a lot of exposure to ultraviolet sunlight, these proteins start to clot in our lens. As you can see in the picture, there are a lot of kind of cataracts that can be formed. So that's why cataract form. And now we're going to talk about the symptoms. It has a lot of symptoms. Of course, the first and the most common is that people start having cloudy or blurry vision. Color seems faded. They start having glare. Lights are too strong for them. Poor night vision, double vision sometimes. And another important and a frequent one is that the frequent of prescription of eyeglasses changes very constantly. Okay. So now, how is detected and treated the cataract? As same as glaucoma, it is a clinical diagnosis. So the first one is with your vision, as you can see in the first picture. You will start losing vision progressively, and you need to go to the ophthalmologist to have a slit lamp exam just to view it. The treatment is basically surgically, yes. The first and the most common one is the phacoemulsification. It is called like that. Uh, an amazing fact is that cataract surgery is one of the, or the most common surgery done in the world. So we have a lot of experience. It is a safety procedure. Um, we all will need that because we all will have cataract at the end of our lives. And this is a picture of a real intraocular lens. It's less than a finger, and it's quite nice.
Yeah, just a little story. A lot of people think that when we talk about intraocular lenses, we mean something like a contact lens that is inside of the eye, but it's not really like that. It's something that we use to replace the lens, because in the procedure, basically we kind of liquefy the lens that we have because it's already clouded, and we just put a new one, a synthetic one. But it's not exactly as a contact lens. It's actually more like a lentil shaped thing that is, of course, transparent, clear.
It's also important to know that this intraocular lens would last forever. So many people ask me if it will fall out or you need a change, and the answer is no, it lasts forever. Yes.
Okay. Well, thank you for your attention. Now it's time for your questions. These are like the most common type of conditions that will lead to progressive loss of vision, and some of them, as you heard, might end up in blindness if they're not treated the right way. So let's see, what are your questions?
Doctors, what is the normal pressure of the eye?
Oh yes, I forgot to tell it. It's between 10 and 21. Of course, it depends on the patient. Some patient will accept a little bit more than 21 without any damage, and some patients will accept a little bit less than 10, but it's like the normal ranges, 10 to 21 millimeters.
Okay, thank you. And I have another question. What is
Okay.
optic neuritis?
The optic neuritis is an inflammation of the optic disc. Normally it is caused by many diseases, but the most frequent one is lupus, and we have another cause of entities like infectious ones with toxoplasmosis. Here in South America is one of the most common causes of optic neuritis. Yes.
Oh, okay. Okay. Thank you.
Okay, you're welcome.
Dr. Mesa,
Yes.
you mentioned that children were born with a certain amount of blindness. I wanted to ask, because of the fact of they have to go through birthing, through the birth canal and all the things they have to go through, could that be one of the factors why they have a certain amount of blindness after they're, I guess, born?
Well, normally it's not a factor, but what it's definitely related is, uh, of course, the birth canal is full of bacteria, in which the most of them are really not harmful for the baby. But in some cases, if there are certain bacteria that might be harmful, when the baby goes through the birth canal, it might end up having an infection in his eyes, and that is actually that unfortunately we see relatively commonly, and is early conjunctivitis, either to some sexually transmitted bacteria that might end up, of course, in, if not treated and detected, in a lot of damage to the eye. But we try now, it's as part of the whole what we call adaptation of the newborns. We do use antibiotic drops as soon as the baby is born to prevent this from happening.
Okay. Thank you.
You're welcome.
Hi, doctors.
Hello.
Hello. Hi.
Hi. How is it possible for no, my question is, how do congenital cataracts form? Like when a baby has cataracts, or someone, a very young child, ends up with cataracts, they haven't had time to be exposed to ultraviolet light or any of that. So how does that happen?
Okay, congenital cataracts is an amazing topic, because there are a lot of reasons, but the main one should be infections, diseases through the mother, as Dr. Mesa was telling the other patient. Congenital cataracts is like an emergency, because when you're a newborn, your retina is really immature, and the first year of life, your retina start or isn't the more important year, because is all your stimulus are new, and your retina start growing and growing and growing. If you have a cataract that is just taking off your vision, you will present later a disease that is called the amblyopia. So it is that your brain or the newborn's baby just block out and turn off the eye that has the brain just think that you have one eye, and when you take off the cataract at maybe 2 or 3 years, just you have one eye seeing, the other eye is there, but you don't have vision, or a really poor vision. It is so important. So we usually try to do the surgery to the newborns as soon as we can. For example, in the first year, until 6 months, until the first year, because if we do know that the amblyopia will see after, for example, at 5 or 6 years.
So, would you, or what about, in your opinion, Dr. Martinez, what about congenital, sorry, or gestational diabetes? Do you think that might be related to cataracts, congenital
Yes.
cataracts?
Also, congenital diabetes and toxoplasmosis and syphilis are the most common causes of congenital cataracts, as in the adults also, but yes, they are the most common causes of congenital cataracts.
And just to add a little bit there, or to say it again, not really the answer for this question, but something that you mentioned is that it is for us a little difficult to explain to people how important it is, the development of not only the eyes but the whole brain and nerves for vision. Because if you have eyes but something is blocking, as you were saying, and the retina doesn't get the right stimulus, then it will not develop. And even if we correct it years later, technically the whole eye will be okay and will be receiving the right things. But since it never developed the whole visual pathway to the brain because it was blocked, then basically you will end up being blind of that eye all your life. Even if we correct these cataracts perfectly, if we do it after a certain time, then the brain will basically forget that it has a right or a left eye and will just ignore images from that part. So it is very important to detect it. We do also check for that in the newborns, and we try to correct it as soon as possible, as Dr. Martinez was saying.
Thank you.
You're welcome.
Okay.
Doctors, question.
Yes.
I have a friend who's been farsighted for, I don't know, wearing glasses for about 20 years maybe. Last year he went to the ophthalmologist and they told him he didn't need glasses anymore. And based on what you've been saying about changes in nearsighted, farsighted vision, is he at risk for cataracts, you think?
No, not for cataracts. Sometimes people have a little bit defect. That's why we prescribe eyeglasses, just for not having how do you say? Sorry, I forgot that. When your eyes get tired when you're reading, that's why we prescribe some eyeglasses with people with just a little bit of defect. But if you have a high myopia or achrometropia, you will need glasses, but it does not have any to see with cataract now. Cataract will develop in everyone.
And there's something that is very actually kind of amazing also, and funny if you think about it, and is that sometimes you might have either you're born with a visual condition and you will end up having another one while you grow up. And in some of them, actually, they might cancel themselves for a period of time, and then you might end up having the opposite. For example, it is very common that certain people that need certain glasses, they start developing presbyopia, and that cancels that defect. And for some time, they can see perfectly without glasses. And then as time goes by, the presbyopia gets worse, and then they end up needing glasses. Or it could happen the opposite. Maybe he needed glasses to closely read, and he starts developing astigmatism, which changes the shape of the eye, and then this defect cancels the one that he had. But this usually happens for just some years, and it's not that common. I mean, but it could definitely happen. But then in some years, he might have needing glasses, and of course, not related to this, but in years he will also develop cataracts, not because they're related, but because with age we all have them.
Okay. Thanks. I got another question. I've been wearing glasses probably for, I don't know, a lot of years, and I seem to remember that sometimes when you go to get your eyes checked, they blow this little blast of air in your eye. What is that? Is that related to any of these things that we're talking about?
Yes, this is called the corneal hysteresis, and it's one of the forms we use to first measure the intraocular pressure, and second to see how flexible is your cornea. And it is quite important in glaucoma diagnosis, because if you have a high flexible cornea, it is a risk factor for having glaucoma. Yes.
Oh, okay. And
Okay.
thank you. And just as an aside, I don't know if we're going off topic here, but what's 20/20 vision?
20/20 vision is that at 20 feet you see as a normal person with a normal vision will see at 20 feet. If you have 20, for example, 30, at 20 feet, you see what a normal person will see at 30 feet. I don't know if you understand.
Yeah, I get it. Yeah.
Okay, okay.
All right. Okay.
You're
Thank
welcome. Okay.
And we call 20/20 the normal vision, but I've seen a lot of people who have better than 20/20. We call 20 like the threshold, but I've seen 20/13, for example, that people that can see very, very, very good. So 20/20 is just like the threshold, but actually vision is a little bit better than that normally.
Okay. Thank you.
Do you know of any medicines or procedures that are kind of in the experimental phase with regard to developing not necessarily a cure, but maybe a better treatment for glaucoma or cataracts or anything like that?
For cataract, there is no cure now. You have some kind of glasses with protective to ultraviolet light that can delay the appearance of the cataract, but there is no cure. And for glaucoma, of course, there is a lot of scientific people studying, but they are developing some kind of tiny dispositives that they are called the MIGS, but it is still on studies. Not now, nothing clear for a cure now.
For example, with cataracts, that's a surgery that, as Dr. Martinez was saying, is the most common surgery in the world. So, of course, this is something that we are not perfected, but something that we are really good at. But it is still evolving. For example, at the beginning, we didn't even really put the intraocular lens. That was the first things that we did. We tried to clear up the lens a little bit, but that was it. Then we started using lenses, but we have to remember that the lens of the eye is attached to some, let's say, muscles that either put it flat or let it be a little more round to change the refraction of the light. And of course, a lens cannot do that because it's just a fixed lens. So as time is passing, we are developing new types of lenses, and now we actually have some that simulate or can accommodate, we call that, a little bit better. So we are doing more things. For glaucoma, for example, we have iridotomies, which is basically with lasers, open some holes in the iris to let this liquid flow a little bit easier. That is something we are also developing. So I think this is something that we are really working on it. Those are procedures that we're trying to use. And I'm pretty sure that in the future, of course, as everything else, we're going to have more and more procedures. Actually, I think in the future for cataracts, we're going to be able to have a very, very good lens, which is totally with the total accommodation of a normal lens. I think that's the future of it. And I think they're developing. And even maybe lenses that are biologically made to be more better fit to our eyes.
Oh, in fact, now we have a kind of lenses, of intraocular lenses, that is called a multifocal one. With the one you can see by farther and for near vision also. So you will not need ever, we hope so, new eyeglasses. For example, there are some multifocal lenses that have ultraviolet also
Protection?
yes, protection, and it as some glasses that turns a little bit dark when you go to the sun. We also have intraocular lenses that get dark when you go to the sun. So we are just working in a lot of things in this topic. Yes.
Yes. Is there any reason, are there, for you to, or let's say you could lose the fluid in your eye? Is there something that could cause it for it to, I don't know, disappear, dry up, or I don't know, is there some, does that happen or could that happen?
You talk about the fluid that is inside the eye, yes?
Yes, yes.
Maybe it should be a big trauma that can make a like a hole in your eye. The only reason that I know that can blow out like all your fluid inside, but there is no other reason that I know. Maybe Dr. Mesa?
Sometimes when I mean, we have to remember that the fluid in the eye is part of the whole fluid system in our bodies. So, for example, with dehydration, when you lose a lot of water, then you might lose a little, of course, not a lot, but a little of that fluid in the eyes. And that's why, for example, in kids, we always look at the eyes to see if they are normal or they seem a little smaller, because if you are dehydrated, the eyes will be dehydrated too. Of course, as Dr. Martinez was saying, the most common cause for losing a lot of that fluid will be trauma. If you have puncture of your eye, then this liquid will start exiting through that hole. But as she said, there are not a lot of causes for that, so these are the ones that I just that come to my mind.
Yes.
Okay.
All right. I'd like to follow off of what Marilyn just asked. So if the eyes can get dehydrated, that would mean that the pressure in the eyes could change also. Isn't that right?
Yes.
Okay,
Yeah.
so then the pressure in the eyes can change for more than one reason. They can change if people have glaucoma, or they could also change if there's a trauma, or it could also change if they're dehydrated. So given that there's so many reasons why the eyes can fluctuate in pressure, why is it that measuring the pressure of the intraocular fluid is the prevailing test to determine whether or not a person has glaucoma?
Well,
Okay. Dr. Meta,
I
yes.
would say two things. First, it's not only measuring the pressure of the eye, but the actual changes on the retina and on the optic nerve that we look. Because as Dr. Martinez said at the beginning, there are people with high intraocular pressure that never develop glaucoma, and there's actually people that develop glaucoma without having high intraocular pressure. So we know it's a risk factor, but we are not entirely sure. We're not able to say 100% that that is the cause for glaucoma. And also the second part will be that it is important, the part chronic is the important word here, because it's not only having high intraocular pressure, but it's having high intraocular pressure in a chronic way. So having it all the time. Like high blood pressure. If you sit at your doctor's office and they take your blood pressure, it might be high, but that doesn't necessarily mean you have high blood pressure. It's just that this pressure fluctuates throughout the day, and what is important is what is the pressure that is predominant throughout the days, and for how long have you had it. That is basically it. I don't know if Dr. Martinez has to add something.
Yes, that's true. There is another thing that I forgot to mention, and it is that in fact, intraocular pressure isn't the same all the day. Normally, it has some kind of fluctuations, as you say, Joe. For example, at the morning is the highest peak of the intraocular pressure. Sorry, and in the night we have the low level of intraocular pressure. And in fact, those kinds of fluctuations are a study says that high peaks and low peaks are the reason of having high risk of glaucoma. So yes, as Dr. Mercer said, it depends of the time you have the intraocular pressure high and the level your nerve tolerates for not getting damaged.
Okay, thank you. And I just want to, I'm not sure if I understood this correctly. So you're saying that with glaucoma, it cannot be prevented, and even after it's treated, the vision will not be restored. Are both of those things correct?
No, it is not. There is no cure, but yes, you can. Well, not prevent it, but you can do some screen test for a soon diagnosis. So if you have, for example, family history, and you are, I don't know, like 20 or 15, you should go sooner than another person without risk factors for look for your ophthalmologist. So if we find your glaucoma at 20, we will have a lot of tools for many time for preserving your vision a little bit more if you don't go never to ophthalmologist. Yes?
So yeah, well, in a certain way, there is no way to prevent it, and if you cut it late, there's no way for us to bring that vision that you lost back. But as Dr. Martinez was saying, early diagnosis permits us to treat it so there's no damage to the eye, so we can treat it early. That's basically it. I hope in the future we're able to cure it and to actually prevent it, really, because we're not able to prevent it. We're just able to treat it early.
Thank you.
Okay.
Okay. Well, thank you. Thank you very much, everyone. Thank you for your attention. Hopefully you're going to be here next webinar. Good night, everyone. Your questions were really great. Thank you very much. Thank you, Dr. Martinez.
Thank you,
Good
Dr.
night.
Marcel. Good night to everyone.
Night.
Good night. Thanks.
Bye.